Hello, my name is Ville Isola, and today we are talking about the consequences of using doping, and especially for young athletes. We will look how the using doping affect young athletes' physical health, the psychological well-being, and their athletic career, and also we highlight that what is strict liability and what it means. At 14 to 18 years old, your body is still developing. Your endocrine system is establishing its baseline for adulthood. Introducing the synthetic hormones during this time interrupts this biological process. Steroids alter your body structure now and dictate how your body functions later in life. And this mechanism is straightforward. When you use synthetic testosterone, your brain detects high hormone levels. The hypothalamus signals the testes to stop producing natural testosterone. So when you take exogenous hormone, our body normal hormone production shutdowns. So your body stops doing its own work. For female athletes, when introducing exogenous androgen, steroids causes a process called virilization, and this means the body begins developing male physical characteristics. So the female endocrine system is highly sensitive to synthetic hormones, and there is a false idea, especially in fitness culture, bodybuilding culture, that low doses or mild compounds are safe for women. They are not. The physical effects are highly visible when you're using banned substances from sport. High androgen levels increase sebum production in your skin, increased sebum, clogged pores, severe acne on the face, back and shoulders. And you also risk premature hair loss. The internal chemical changes show up externally. Muscle tissue adapts to chemical enhancement much faster than connective tissue. Steroids increase muscle cross-sectional area and force output rapidly. However, tendons and ligaments lack the blood supply to adapt at the same rate. So high muscle force plus weak connective tissue will produce tendon ruptures and severe joint injuries. Anabolic steroids also directly impact cardiovascular health. They cause left ventricular hypertrophy, meaning that the heart muscle thickens and becomes stiff. They also lower HDL cholesterol and raises LDL cholesterol. And this physiological change means that it causes the high risk of early heart attack. Doping affects the central nervous system. Hormonal fluctuations alter neurotransmitter balance in the brain, and high doses of androgen may trigger aggressive behavior, irritability, and impulsivity. Your mood might change rapidly and you lose control over how you react to normal stress. And when you stop taking steroids and the synthetic hormones leave your system, your natural hormone production is still shut down. That can cause severe fatigue, loss of fat-free mass, and clinical depression. And recovery phase might take months, and sometimes the endocrine system never fully recovers. Body image issues often drive the decision to use doping. So relying on chemicals creates a psychological dependency. You start believing you cannot train or maintain your physique without them. So true confidence comes from mastering your training and nutrition, thorough discipline, and not from a temporary chemical state. In social media, we see lots of massive and extreme lean physiques, and when we see these images constantly, our brain starts to shift its baseline for what is normal and what normal body looks like. So know this, that most of the images you see in social media are the result of chemical enhancement, acute dehydration, or good lighting, or even digital editing or AI. In anti-doping, we use the principle of strict liability. And this means that you are completely responsible for any substances found in your blood or urine. And it doesn't matter if you ingest abandoned substances by accident or you get positive test from contaminated supplement. It's always the positive test is a rule violation. And please understand that not all doping is about building big muscles. Often it's about losing weight or getting fast energy. So taking a basic fat burner or pre-workout supplement can easily cause a positive doping tests. So be aware what supplements you are using. About the penalty for using doping. For intentional doping is almost always 4-year ban from all sports. You lose all your competition results, medals and titles. And 4 years, that is a long time in your athlete's career. You cannot compete, you cannot train with national federation team. And those sanctions, they go beyond the sport. The anti-doping rule violations are published publicly, and this damages your reputation. You might risk losing sponsors, financial support, and the trust of your coaches and peers. So do not use doping and focus the variables you can control. Eat enough, use progressive overload in the gym if the aim is to build muscle. Adherent your training program, sleep and eat enough. Now we move to the practical activity. We will divide into small breakout rooms for 10 minutes. And we have the case. 70-year-old junior bodybuilder buy a pre-workout supplement online. The label lists only caffeine and citrulline malate. So the athlete tests positive for banned stimulant due to cross-contamination. So now, in your groups, answer these 3 questions, and please take a photo with your phone so you remember those questions, and I will also send them to you into the breakout rooms. But for example, the question 1, how does strict liability apply on this specific case? 2, what are the immediate consequences for the athlete's reputation and sport career? And 3, what practical steps prevent this situation? So please discuss in those breakout rooms roughly 8 minutes, and then we come back here and we conclude this session. See you in 8 minutes.